Hi, I'm Cian O'Carroll, and back in 2018 I met Vicky Phelan when she was looking for a solicitor to help her fight her case. She went on to win that case and uncovered a shocking healthcare scandal that has affected so many women and families across Ireland. We also became friends. Vicky went on to fight one campaign after another for women's healthcare in Ireland, and all the time fighting for her own life, fighting for more time. This is a series of conversations where Vicky and I discuss what went wrong in cervical check, how those fatal and life-changing mistakes happened, and look at what Vicky has achieved since she became an advocate for change. Hello again, I'm Cian O'Carroll, and once more I'm in conversation with Vicky Phelan. Good morning, Vicky.
Good morning, Cian.
Where we finished up in our last conversation, you had taken us to the point in January of 2018, when you had just learned the fairly shocking news, I presume, that your cancer was back, that you were experiencing a recurrence of your cancer. Presumably it had never gone away, it had been there all along in tiny quantities but growing. And at this point you had discovered in December of 2017 and into January of 2018 that you had a serious problem on your hands.
Yeah, so I suppose in December, before I actually went in to have the sit-down meeting with my oncologist in January, I knew in December things were bad. I'd had the PET scan and I was waiting for a meeting with my oncologist to go over the results. And I thought that would happen before Christmas, but between the jigs and the reels, I don't really know what happened. I think maybe part of it was probably they wanted me to have a nice Christmas and not have to give me this bad news. But at the same time, I think, at the back of my mind, I knew, this wasn't going to be good. But I didn't tell my family. I told nobody really, to be honest, apart from a couple of colleagues at work. And that's pretty much it until after Christmas, because I just thought, there's no point in saying anything or doing anything and upsetting everybody for Christmas. Particularly because I still was feeling well. I mean, that was the shocking part of it, really, that I didn't feel, that I was, ill. You'd expect that you'd have had, I had no real symptoms. It was a very unusual situation to find myself in. So you kind of start questioning it. But, that all came down to really crashing around me, I suppose, in January. So when I went in then to meet my oncologist on the 12th of January was the appointment. My mother actually came with me for the appointment. So I told my parents just after Christmas, I think on the 29th, I gave it a few days.
But up to that you hadn't told anyone?
No. I had told two colleagues in work, that was it. I had kept it quite under wraps, really, to be honest, because I needed to get my head around it. And I don't know, Cian, I suppose I'm the type of person, I'm not really good when people get upset around me. I'm not good at that, so I prefer just to not have it happen, So I think when you're in a situation like this, people tend to get upset for you on your behalf, and that doesn't do anything for me. So I'd rather not have it happen, So, and it's what I suppose the way I looked at it was, nothing was going to change over Christmas, so there was no point upsetting everybody over Christmas with this news when nothing was going to change really until January. So I kept it to myself pretty much until I think it was 29th.
Oh, was Christmas different for you then? It must have felt a little bit, the potential clearly was there that this was your final Christmas.
Yeah, it was, and I went all out. I really did at Christmas. I would always be the one in the family who organises the Santa visit. So I usually go somewhere different every year. So we had gone to Birr Castle actually that year. It's one of the pictures. It's in my book. Yeah, that picture from. Nobody in that picture knew except for me. What I was facing into, and it was hard. It was hard at times to keep that information to myself. And I suppose I was probably a little bit more into Christmas than I normally would be. I'm not a huge Christmas fan, I have to say. So my mother was probably a bit taken aback that I was all into Christmas. She kind of said it to me afterwards when I told her the news. She said, "Oh, that's why you were so kind of all gung ho for Christmas." I kept it to myself until literally just after Christmas, and then I told the family, and I'm glad I did, to be honest, because the reaction was awful. Obviously, everybody was very upset, and why would I have had that over Christmas? It really wouldn't have made any difference. So yes, it was hard on me, but at least that's only one person that was, upset. Not it would have been more difficult for me to watch everybody else kind of treat me differently as well. I think so I just couldn't.
That's what I was
face that.
imagining, that people would be looking at you the whole time in all of these special looks.
Yeah,
And
I get them now. I get them now.
Because your prognosis at that stage, as we found out later, but at that time of the diagnosis of the recurrence, the statistical prognosis was for 12 months.
Yeah, 12 months at the most.
At that point, at Christmas 2017, you had a likelihood of only surviving 12 months.
Yeah. So it was in the back of my mind that if that was correct, I wouldn't see the next Christmas. So it was at the back of my mind. And
did you know that time could be that short at that stage?
No, I didn't. But I suppose I had what I was kind of making up in my mind, and from what I was reading, I had kind of a longer time frame. So I suppose from the type of recurrence I had, because I knew the size of my tumour and where it was, I was looking up research to see kind of had any other women with cervical cancer, had this type of recurrence, how long did they last? And what I was coming up with online was between 12 to 18 months, which was slightly longer than what I was given. So I knew it was somewhere along those lines, I suppose. But I do remember going into that appointment in January and really being taken aback, to be honest, when she told me it was less than what I thought. I really thought I had a little bit longer. But when she said
that was with your radiation oncologist.
Yeah. And that appointment actually, I had organised, Amelia had an appointment as well at the hospital on the same day with her neurologist. So she had an appointment for her epilepsy with her neurologist in the same hospital. So she had her appointment earlier on that morning, and then we went along to my appointment, and Mam was with me as well as Amelia. So she stayed out in the waiting room and I went in on my own. And I remember the oncologist asked me, and I would have went to most of my appointments on my own, that wasn't unusual. But I do remember her, when I went in for that particular appointment, she asked me, did I not have anybody with me? And I knew then, when somebody asks you that question, the news is not good. And I said, well, my mum is here, but she's in the waiting room with my daughter. So she knew, that my mother couldn't come in and leave my, daughter out in the waiting room on her own. So I kind of said to her, to make it easier for her, I said, so the news is not good, obviously. I said, is what you're going to tell me, really that bad? Is there no treatment that's going to help me here? And that was when we got into the conversation about, from her point of view, because she's a radiation oncologist, she could do nothing for me because my tumour was too large. So she was handing me over then to the medical oncologist. So I remember asking her at that point, how are you so sure that this is a recurrence and not a new cancer? And she said, well, with the, all the research shows that the recurrence travels up. And I said, well, that's not what you were telling me for the last 2 years. I said, you've always kind of, I said, I've never been had a scan further up my body where the cancer had come back. I said it was always, I was always told it was kind of in the local region in the pelvis that the recurrence would be quite normal down there, and that kind of more distant would be rare enough. And I wanted to know how they were so positive that it was a recurrence and not a new cancer, because I had looked up the type of tumour I had, because it was in my lymph nodes. It could have been lymphoma, and that's a different type of cancer and requires a different type of treatment. So I said to her, is there any chance?
If it's a recurrence, it is likely to be fatal. If it's a new cancer, it's a whole new separate treatable disease.
Exactly, and that was, I suppose, that's why I was clutching at that straw, really, and that's why I asked her, are you sure? How sure are you that this is a recurrence and not a new cancer? What if it's lymphoma? So I said, can I have a biopsy? And she said, well, that would be highly unusual. And I said, well, I want it. I said, I'm not going to start any treatment until I have a biopsy and know for sure that this is definitely a recurrence. I said, I think, given my situation, a biopsy is surely warranted before any treatment begins, given the size of my tumours.
Okay.
So she agreed to that, and she said, okay, I'll organise for a biopsy. And she said, the next time, you come back after the biopsy for the results, it will be with the medical oncologist, who was Professor Gupta. So in fairness to the hospital, I had the biopsy the following week on the 19th of January, and then the following week I met Professor Gupta. So I had 2 weeks to kind of do a lot of research really about options, because I suppose at that stage I knew that all I was probably going to be offered was palliative chemotherapy, and I wanted to see were there other options out there that I could try and avail of to give me more time.
And at that stage you were still feeling relatively well?
Yeah, this is the thing. I really was. Apart from the lower back pain, which I'd been complaining of for, almost 2 years really since I'd finished treatment, I had no other symptoms at that stage,
But that's the middle of January, and yet by the middle of April you were very, very sick.
Exactly.
So things deteriorated quite rapidly.
They did. They really did. And it took me by surprise. I think it took everybody by surprise how sick I became. And I suppose because I had refused the palliative chemotherapy and I wasn't on any treatment, that didn't, it wasn't good for my cancer, obviously. It meant that, it was growing with nothing to treat it, while I was waiting to get on another drug. So I think that's why it got so bad so quickly,
Right.
I remember at one point thinking I was constipated, where it was at the start of having a bowel obstruction really, so things were starting to get quite complicated by April really at that stage.
Because by the end of January, when I met you actually sitting at this table, myself and Siobhan Ryan, and you had a long chat here, and I remember you were well, you seemed well, and yet 12 weeks later we were at the trial and you were dying. Yeah, I was really at that point. And I suppose the biggest change I noticed, and I'm sure you did too, and for people who wouldn't have known I had cancer, people would have assumed I was pregnant. I mean, the tumour was so big. Do you remember? It had pushed out so much. I remember you showed me, it was quite a distended abdomen. And then now you look at you, 3 years on, and like as I often say to you, you're clearly a faker.
I know, you'd think it, wouldn't you? And honestly, it's the beauty of the drug. I think there's probably going to be a market for this drug for women, for the the face, for the skin, because definitely one of the best side effects from this drug is my skin is the best it's been in years. I'm 46. And I definitely don't have the skin of a 46-year-old. A lot of people have commented on my skin, and it's definitely the drug. I suppose if it's boosting your immune system, it's boosting everything at the same time, which is great.
Mind you, it makes creme de la mer look pretty cheap.
Yeah, it does, doesn't it? It's an expensive drug to, $8,500 a month. Yeah, I don't think most people could afford that.
No, I can't see it taking off.
No.
But to come back then to that fairly harrowing meeting, I presume, with Dr. Walsh, she tells you that she is, the plan leaving that meeting was to go off and have a biopsy, and you were now being passed to medical oncology, and you come out of that, your mum and your daughter are outside. Is that when you went to the bathroom first and had a private cry?
I did. I've never understood that term. Often until you experience something, there are terms or phrases in the English language that don't really mean anything to a lot of us, I think, until you actually experience it. And that phrase where the legs went from under me? That's exactly what happened. I'll never forget it. I remember standing up from the chair and walking out of Dr. Walsh's office, and my legs just felt like jelly. I could barely hold myself up. And I knew I was going to get sick. Just this whole, the shock really just took over so quickly. I couldn't. The only other time I experienced something like it was at Amelia's accident. After Amelia's accident, I had a very similar reaction where I was puking, and just the shock again was very similar. So I knew I couldn't go straight back out to the waiting room, so I went into, thankfully, where the doctor's offices were, there was a corridor and there was a bathroom there, thank God, so I could lock myself in, and I went in for about 10 or 15 minutes, and I had to pull myself together because I knew I couldn't walk out until I'd dealt with it some way myself without going out kind of and breaking down. Because I knew once I saw my mother, that was it, I wouldn't be able to hold it together if I hadn't kind of allowed myself some bit of emotional, a cry really before I went out. Right. So I literally, and I'm sure people heard me, but I didn't care. I was so upset. I remember sitting on the floor in the bathroom, just, crying and
Out loud.
almost hyperventilating because I couldn't believe this news. And I started to panic. I was already panicking at that stage, thinking, what am I going to do? And all I could keep thinking was, 6 to 12 months, and my kids were, what age at that stage? 2014. Amelia was 9 and Dara was 3. You know what I mean? They were very young, so I just thought, Jesus, what, we had, as I said to you, we had been in the hospital that morning for a checkup with her neurologist because the previous year she'd had seizures. So all of this was going through my head. My children need me. This is not right. How am I going to come back from this? And I knew I had to find something. So, I pulled myself together, kind of splashed water on my face and walked out to meet Mam and Amelia. And Amelia was on, I don't know, she was reading a book or she'd her head down in something anyway, thank God. So she didn't look up, but my mother did. And the minute she saw my eyes and saw my face, I just went like that, a little shake in my head. And she knew just from that this was bad,
Bad.
Yeah. And I had to drive home. I remember having to drive home, and it was the longest drive because myself and my mother were barely even talking. What can you say? We were trying to chit chat, but it was quite difficult.
When did you get to talk to her then?
So we packed Amelia off up to our room when we got home and put her in front of the telly, a Netflix movie or something, and gave her treats to keep her quiet. And we came back down here to the kitchen, and that was it. I told her then, and sure, Mum got upset, and I got upset, and I had to ring my aunt to come up and collect Mum because I knew she wouldn't be able to drive home. She wouldn't be within her right mind to drive home. So they, two of my aunts drove up, her sisters, and one of them drove her back. So, and they stayed here for a while for tea and made dinner. Imagine, I don't even remember, to be honest, much of that day. It just kind of went by in a blur, really.
And when did you get to start planning then? When did you start forming your plan of action?
So I knew then, I think the following day or 2 days later, I got an appointment for the biopsy. So I knew the biopsy was scheduled for the 19th of January. So Mum said she was going to come back up and come in with me for that. And in the meantime, then I started looking up, researching drugs. So I was looking for anything, for cervical cancer other than, because I knew what I was going to be offered was only going to be palliative. And I thought I have to try and find something else that I'd be able to propose to, the medical oncologist I was going to meet and see if there was any chance of me getting on some other option. So that's what I started doing. I started researching different drugs, and I suppose after, a very short period of time, I realised that there wasn't much out there. It was quite scary actually to realise how bad this was when it got to this stage. And I tried not to panic and pull myself back, and I kept looking, and I found a clinical trial in America. And one of the drugs on this clinical trial was called pembrolizumab. And I just started looking it up just to see what the information on the drug was. And then I realised it was actually made by a company called Merck Sharp and Dome, who have a presence here in Ireland. And I thought, well, if it's made, and my brain, that's the way my brain operates anyway. I thought, well, if it's made here in Ireland, it must be used. It must be used for other cancers. So I started looking up, what uses pembrolizumab was used for here in Ireland, and I realised that it was used for other cancers, but not mine. And then I started kind of tracing, what hospitals. So I started looking at, I contacted Merck and asked them, what oncologists are prescribing this drug, and I got a list of oncologists, after a lot of badgering now, might I add. It took a while.
Just to unpack that, as they say, a little bit. I mean, you're saying that, I looked this up and I looked that up. Where do you look up clinical trials? Where do you look up who to talk to in Merck Sharp and Dome to get a list of the consultants they're working with?
So
how do you
Merck
do that?
Yeah, how do you do that? Well, I remembered.
Go back to the clinical trial.
So the clinical trial, to find a clinical trial, I looked up clinical trials in Ireland first. So there is a body called Cancer Trials Ireland here in Ireland, but we're a small country, we don't have a huge amount of clinical trials, but I did look up their clinical trials and saw that there was nothing for cervical cancer, or any of the drugs that they were using weren't for the type of tumours I had. So
but they have a website, and they have a register on that website of all of the trials.
Of the list of trials that are current, that are recruiting. Yeah.
And,
so that's
and
how
each
I
trial
found that.
will tell you what the indication is, as in which type of cancer.
Exactly.
You,
So they have the trials organised by cancer type, and that's how you search them. So it's, they have a list, and you click on the list. So prostate cancer, gynae cancers, lung cancer, and you click in, and it'll tell you like if there's 2 or 3 trials for each particular type. And obviously, for cancers that have more numbers, larger numbers like lung and breast, there are obviously more clinical trials. Whereas with cancers like mine and much rarer cancers, there are very few clinical trials, and I kind of quickly realised that because this is such a rare cancer, or has small numbers, there aren't a huge amount of clinical trials really. Now there are more in the last 2 or 3 years I've noticed coming on stream, which is good.
Right.
But at the time there really wasn't much.
And maybe just to explain as well, because we're making a certain leap now from the
what a clinical trial is.
Chemotherapy you were being offered, and that is a range of drugs which are designed, as I understand it, to identify certain features in cells and attack the cells, but it's going to attack healthy cells as well as the cancer cells, and therefore causes more extensive damage, and it's very sickening and all of this. And I presume that's different depending on the type of chemotherapy that you're on. But in this case, pembrolizumab, this is a different type of drug, isn't it? It's not a traditional chemotherapy. So would you explain that?
So pembrolizumab is one of these new type of targeted therapy drugs. So chemotherapy is not a targeted therapy drug. So it literally, as you said, it attacks everything in your body. It doesn't just attack your cancer, it also attacks healthy cells and kills off healthy cells as well as the cancerous cells. So it's a kind of a very blunt instrument, and it causes a huge amount of side effects. One of the big ones for a woman anyway is you lose your hair, your eyebrows, everything that makes you look like you. And for me that was a big thing at the time because my kids were so small, and I think it's a huge shock to the system when the hair goes, I think, But also because I knew how sick I had been on the first dose of chemo, and I only had 5 doses of chemo, for my first experience with cancer. I had 5 weeks of treatment, but I only had 1 day a week of cancer or chemotherapy. And I remember being so sick, and it took me 3 or 4 days every week just to get over that dose of chemo. And this time round, I knew, because the radiation oncologist had given me an indication as to what this would involve. She had told me, obviously, my medical oncologist would talk to me more about it, but I did ask her a few questions. I wanted the names of the drugs so I could go off and look them up myself. So it was a combination of 3 drugs. So there were 2 chemotherapy drugs and another drug. I don't know what kind of a drug it is, but it's called Avastin. So they do a combination of this Avastin drug, which, it does extend women's lives, but the quality of life is, from what I had read, and what I had seen from other women is poor, and then these 2 very toxic chemotherapy drugs, much stronger. And I did ask her that, and she said yes, one of them is particularly toxic. And
well, you're not saying it's good or bad, you're just saying that you researched it and you felt it wasn't for you.
Exactly, I wanted something else. I just thought there has to be something else out there must be, and I was willing to try it because I thought I'm young, a young woman, and I have young children, and I really wanted to try something else before I went down the palliative chemotherapy road, because I knew once I started on the palliative chemotherapy, that's it, there was no coming back. It would give me a certain amount of time, and that was it, so I just wanted another chance, I suppose. So I found this immunotherapy drug, pembrolizumab. So immunotherapy drugs are kind of the new kids on the block, really, in cancer treatment. They're becoming more common now than they were even 2 years ago, to be honest. And they're targeted therapies, so they actually target and seek out your cancer cells, and they target your cancer cells and your cancer cells alone. So it doesn't, these drugs don't damage your healthy cells as well. And that's why, I've been on this drug now for nearly 3 years, and this is why I'm as well as I am, because it doesn't attack everything else in your system. It boosts your own immune system to attack your cancer.
And as I understand it, in the broadest terms, these drugs allow, they boost your immune system, but they allow it to identify or attach onto and then destroy the cancer cells.
Exactly, that's it. So in order to avail of these drugs, you actually have to have a test done to see whether or not you have these markers. So there are markers on your tumours that will tell, whether or not you are a candidate for this drug. So they're to be a candidate for these type of immunotherapy drugs, particularly for pembrolizumab, you have to have what are called PD-L1 markers. So what they do is they take a sample of your tumour, so you either have another biopsy, or if you've just recently had one, which I had, you can have it tested, a sample of that tumour, and see whether or not your tumour has these markers. And you have to test above 55%, so your tumour has to have at least 55% or more of these markers in order for it to work. And I was very lucky that when I had the test done, I was in the 65 to 75% range, so I knew I was a good candidate for this drug.
Very good. And that presumably means also that if people have sufficient scoring on the PDL test, that the drug is a good bet for them. Exactly,
it is. It generally means that it will work, and the higher you score, the better. Obviously, if you score 90 to 100%, it means it will work on pretty much all of your tumours, and that's why I'm at the stage now, I suppose, nearly 3 years down the line, where some of my tumours are starting to grow back, because 25% of my tumours were never going to respond to pembro, but it kept everything stable, for this length of time. Yeah.
No, I was just on that point though about people's suitability for the drug. At least presumably you would have that test done, then you would have the drug administered, and if it wasn't working after 1, 2 or 3 doses, you would probably be taken off it. It's just
exactly.
that the famous Office for Pharmacoeconomics, which has to make these obviously very difficult choices for people, they seem to be very strongly of the view that the state wasn't going to invest any money in these expensive drugs for people, because for the majority of people they wouldn't work. And it seemed to me that was kind of ignoring the fact that
there's a test. Exactly.
Yeah.
And I mean, it's a very obvious, if you don't test above, if you don't get above the 55%, you're not a candidate. So that's a very simple, for me, to tell people,
and if you are a candidate, you're only a candidate for a few doses, and if it hasn't worked at that point,
then you're taken off it. Exactly.
Right.
Yeah. And usually that is the case, because in my case, when I started on it, I started on the 16th of April, and after I think 6 sessions, I had 50% shrinkage in my tumours. So it was quite obvious that it was working for me. And some people, may not have had any shrinkage. So I think they allow usually about 2 or 3 months. They usually know whether or not it's going to work. So I suppose the way I look at it is, Cian, people should be given an opportunity to try these drugs. I mean, you have to pay for this test yourself, and the test is quite expensive. It's nearly €2,000 to have this tissue typing test done, but it's well worth it if you have no other options, and at least it gives you an answer either way. And I suppose the way I look at it is, I had nothing to lose. You know what I mean at that point.
Yeah. Well, maybe after all that's happened this year with COVID-19 and the vast amounts of money that have been spent in dealing with this, hopefully we'll find that those arguments aren't as strong in future to outweigh the moral argument that we as a society should provide funding to at least give people a chance at a good quality of longer life when they're in this position.
Absolutely.
Vicky, we might just pause there again and come back to this in the next piece.
Sure.
We're trying to keep these conversations to in or around the 30-minute mark, for some technical reasons, but also because it's just an easier amount of a chunk to swallow. Exactly. So with that, thank you again for joining me in conversation, and we'll be talking again shortly. Thank you, Vicky.
Thank you, Cian. Thanks very much.
Hi. Vicky and I hope that you've enjoyed that episode and you're finding the series informative. If there's anything else that you'd like us to discuss or touch upon, please mention it in a comment below. And to be informed of future episodes, hit the subscribe button.